Hi, today I'm going to be doing trach care. So the first thing I would do is check my orders before I come into the room and make sure that I have the right patient and that they don't have any allergies to latex or something like that if I was going to be using latex gloves, which I'm not, but just in case. I would then gather my supplies, come into the room, do hand hygiene, and introduce myself to the patient. I would ask for his name and date of birth and then check that with the wristband. And I would ask him if he's ever had this done before. If he hasn't, I would go ahead and explain in depth of what I'm going to be doing, and if he has, then I would just reiterate the main points and ask him if he's in any pain or anything. I'm going to raise the bed to a workable height, and I would be assessing the patient's pulse ox if we had one in here, and I would auscultate all the breath sounds. You want to make sure your patient's sitting upright, and if he had been coughing or if it looked like there was a lot of secretions, I might go ahead and suction him. Okay. So just looking at my patient, he has oxygen on, so I'm going to go ahead and put some gloves on. Provide privacy. And I'm going to go ahead and just unhook one side of his oxygen. But I'm going to keep it close and keep it on there for whenever I get done. So I'm just going to barely remove it. I'm going to check the cannula size, and it's a size 6, and I have a size 6. I'm going to make sure that there's nothing else I need to do. Then I'm going to open up my kit and open up my inner cannula. I'm going to take the lip of the kit and move it here. I'm going to open up my sterile saline and pour. And at that point, I'm going to take off my gloves, and I would have a biohazard bag here that I would drop them in. So I'm going to open up my sterile gloves. So now that I'm sterile, the only part that has to be sterile is replacing the inner cannula. So I'm going to contaminate this hand by taking out the old inner cannula and dropping it in the biohazard bin. Then I'm going to pick up the new inner cannula and twist it into place. Okay, so now that the sterile part is over with, I'm going to go ahead and assess the trach and see if there's any excessive drainage. I'm going to go ahead and pull out this fenestrated gauze that was here before. Place that there. I'm going to find my Q-tips for cleaning. And I'm going to just get up underneath the edge of that faceplate. And drop that in the biohazard bin. And then use my other Q-tip and get up underneath any of the ridges. Drop that in the biohazard bin. I'm then going to take a clean, dry piece of gauze and pat it dry. And drop that. And now I'm going to take the fenestrated gauze and start to slip this underneath. I would have told somebody at my workstation that I was going to be doing trach care in case I needed help during, so I'm going to just untie one side of the trach ties You never want to untie both of them at the same time. I'm going to slip this gauze up underneath it. I'm going to grab the new tie, and I could holler at one of my partners and ask them to come help if I needed it. I'm just going to tie this into place. And I'd be looking around this area for skin breakdown because it can happen around the ties. I would then remove the pillow and look at the back of the neck and make sure that there's no breakdown. I'm going to come back around on this side, remove this side of ties. Make sure that this gauze is in place. And I'm going to make sure that there's 2 finger breadths in between the tie and his neck. And then I'm going to go ahead and tie it and ask him if he's comfortable. I'm going to replace his gown and replace his oxygen. I would return the bed back down and replace his pillow. And be sure that the collet and the wheels are both locked, and dispose of all of my stuff.